My name is Jeff Kuhlman, and I serve as the Chief Quality and Safety Officer for Advent Health.
And I'm Danny Peach, the Executive Director of Clinical Innovation.
Asked to improve clinical outcomes by refocusing patient care, Jeff Kuhlman and Daniel Peach proposed that culture is the axis on which meaningful transformation occurs. With an aligned culture, strategies to achieve our goals can be better designed and implemented. To make this change in a quick and affordable way, they began with the gold standard of change management.
When you talk about culture, you have to talk about change management. Change Management 101 was laid out decades ago and is still pertinent today by John Kotter. It has 8 steps. The 8 steps are well known and have stood the test of time.
Jeff and Danny cover the details of the improvement algorithms they created to save the lives of patients with sepsis, chest pain, and syncope, and share their methodology so that other hospitals can transform their own healthcare culture in transformative healthcare.
Now, we took those 8 steps and I won't say we revised them, but we elaborated on them. So we took that design element and we took the focus points that are in there. So look at the evidence that's there. Gather the right team together that will be able to drive that change forward. And once we have that, to really start to look at how we document that. How do we put it together in a format that will be understood and can drive forward? Once we have that, we can then build the pilot. That's the working area that we start with. We can make tremendous learnings from that. And we can start to take those results and look at where the deviations are, because they're the really important part of what we're looking to. When we understand the deviations, we know what we need to change, where we need to maybe mitigate some of the issues, the barriers that are there. Then when we have that, we go to that full implementation. We've got to get the education out there. What does that look like? It may be different for physicians than it is for nursing staff. It may be the same, but we look at how we get that out there. What medium do we use? And then lastly, the important part. This is that sustain element. How do we keep it going? Let's not just put it out there and let it drop away to the wayside when we're finished. Keep it moving.
Once they had a methodology framework for creating change, they worked toward improvement. Creating change requires a different kind of thinking.
I hear you describing a methodology, a proven methodology that's based on proven principles of change management. So as human beings, there's at least 7 different types of thinking, and everyone's different. Most Americans, most healthcare executives are in analytical thinking. You analyze the whole process, you look at one part in a silo, and you focus on that. A better way is with synthetical thinking. Synthetical thinking is how doctors practice every day. They take disparate pieces of information, of data, of history, of diagnostic information, and they put it all together into one complex whole of taking care of a patient. Synthetical thinking is powerful.
Now take that power and drive it into an improvement triad. That's taking the data that's been gathered, looking at that evidence-based, consensus-backed direction, and then drive it from the physician. Make it physician-led. Once we have that, we then build the triad. You're looking at, to create that innovation, we need to gather the evidence that's there and then build that around the clinical outcomes. You now add that to the method that we looked at earlier. Now we start to build the process that's there. Now we start to break the pathway down and to start to look at the results. So there are a lot of challenges that come about. And often the physicians and the hospitals build on a mismatched business model. The language is different from both. There needs to be an appropriate vehicle for the physicians and the hospital to engage. And that's often where you'll see items like the bundled payments come in.
And sometimes there's a disconnect between the financial and the quality incentives. So working on removing those, caring for patients.
And again, you could overlay that information. We're again empowering the front line. We're looking at those reasonable measures. And when you break it down using the triad and using the consensus algorithm that's there, you can start to break that down and picture where you need to go and where the best benefits of those patients come out. Also, with part of that, we need to look at what the data looks like. How do we bring that medium to bear? And that's where we can use the dashboards and other elements that allow physician-driven, nurse-driven data, not just information from an administrative point of view, measuring the money, but looking at the outcomes, looking what happens to the patients, those elements that you talked about earlier.